My name is Dr. Matt Ritterman. I'm a psychologist and a research director at TIES, and I'm here with Vanessa Perez. And we'll be talking to you all a little bit about some of the research projects that we did in collaboration with Pritzker Center last year. There were a total of 6 that we're very fortunate and grateful to collaborate on with Pritzker Center and other community partners, 4 of which we will talk about today. So here's a brief overview of the 4 presentations. I'm going to go through the first 2. Vanessa will go through the last 2. And for the sake of time, I'm going to try to go through as thoroughly and briefly as possible at the same time. So the first project, titled COVID-19 and Resource Families, an examination of impact and disparities a year later, was really a follow-up study to an original project done by TIES and Pritzker a year earlier. So we collected data shortly after Safer at Home, after the COVID-19 pandemic, looking at the impact of COVID-19 on resource families in LA County. In collaboration with Pritzker Center and Foster Together Network, we distributed a follow-up survey about a year after the original one to look at the ongoing impact of COVID-19 on resource families. And in the follow-up, so I think the first one we had approximately 700 unique responses. And in the follow-up a year later, we had over 500 resource parents respond to the survey. So you'll see a comparison to time 1 and time 2 of some of the feelings and anxieties related to COVID-19 reported by resource families. So you'll see that there was significant anxiety about being infected, concern about family members, uncertainty about the future and stress related to that, and lack of control. And you'll see at both time points there that the percentages either were the same or went up from time 1 to time 2. Other things that resource parents are worried about during the COVID-19 pandemic. So 70% reported concern over not seeing loved ones in person. 60% reported being moderately to extremely worried and missing events that are important to them and their children. Half expressed concern about children and their care falling behind in school. And 40% reported being worried about delays related to adoption. Other things that came up were mental health concerns. So you can see about 40%, 2 and 5, reported moderate to high worry about their mental health. Half reported worries and concerns about the mental health of the children in their care. And half reported moderate to high worry about the children in their care falling behind with important services or treatment. Other things, direct quotes. So these were answers to open-ended responses on our survey. Resource parents were also worried about healthcare shortages, housing insecurity, violence, access to resources, infection rates rising again, generally speaking and existentially, the mental health crisis going on in the world, helping kids adjust, and just increased stress and anxiety overall. You will see some silver linings reported on the screen that we looked at both time 1 and time 2, and there were pretty significant silver linings. So you can see resource parents did report having a deeper appreciation for life, being closer to their family, new ways of connecting with family and friends. And although most resource parents did report positive effects at both time points, which continues to generally just highlight the resolve in the face of adversity, the important thing to note here is that despite the silver linings, adverse impact was relentless. And so it was the same across both time points. And one thing that we do know about resource families, they already report high levels of daily stress. And it is pretty evident that the COVID-19 pandemic elevated that stress further. And beyond that, the stress appears to be chronic in nature, which further adds to the adversity and challenges that this community already faces. Another aspect that we looked at beyond the direct impact of COVID-19 was how families would like to access services moving forward, particularly in this in-person to remote to now hybrid role that all of us are living in. You can see a breakdown of percentages there across different services. So we have mental health services, trainings and workshops, support groups, developmental services, and healthcare. And what you can see is, generally speaking, depending on the type of service, resource families kind of wanted it to look differently moving forward. When it comes to parent training and workshops, for example, you can see a majority want things to be telehealth only or hybrid. But when it comes to some more sensitive services like seeing a doctor or developmental services, you see more families reporting wanting those to be a combination of in-person or hybrid. In general, one thing that the pandemic afforded us as another silver lining is that half of resource parents reported that having virtual services allow them to access things they otherwise would not have accessed in the past. And one of those things that they reported to be very helpful, which you'll see in the next graphic underneath, was social workers. And this theme came up across both time points, time 1 and time 2. So you'll see that the most helpful resources reported by resource parents, the top one across both time points was social workers advocating on their behalf and video visitation by their social worker. Other things that came up as being really helpful in terms of responding to need was access to technology, resources provided by the school district, and free technology. I think a lot of families, particularly at the beginning of the pandemic, were incredibly grateful to have those resources. But the social worker support came up across the board. I think over half of resource parents reported that video visitation was extremely helpful. And when we ran regression analyses, so all of this data is descriptive in nature, but when we ran more inferential statistics and regression analyses, what we found was that resource parents who had more support from their social worker reported increased access to resources, decreased coping challenges related to the pandemic, and those with more resources were more likely to report positive impacts of the pandemic. So clearly, social worker advocacy, support, and meetings were incredibly helpful across time points. And the more social workers were involved with families, the more resources families reported having, and the less challenges they reported having with COVID. The other emphasis of this paper was to look at health disparities between different groups of resource parents. And regression analyses reveal differences between groups related to this impact. Most notably, compared to white resource parents, Black and Latinx resource parents reported significantly more adverse impact of the pandemic, including things like anxiety about getting infected, the prospect of reopening, uncertainty about the future. And our findings really do parallel all of the research that all of us in this room clearly know, documenting the disproportionate impact of COVID-19 based on race and ethnicity, and likely reflects the often cited health and general health care disparities rooted in longstanding structural and systemic inequities in our country. Despite reporting more adverse impact and less access to resources, both Black and Latinx resource parents also reported significantly more positive impact, those silver linings we mentioned, including gratitude for friends and family, acceptance of things outside their control, which further highlights the grit and resistance of resource parents of color. Despite navigating the complexities of a child welfare system and the history of documented health and social disparities, all of which have been exacerbated by COVID-19 and related stressors, this community appeared to have found ways to reframe the crisis and demonstrate unique resolve. So some recommendations based on this is, given the disproportionate number of Black and Indigenous children in foster care, I think it's really important that we understand the experiences of not only youth in or adopted from foster care who identify as Black or Indigenous, but also resource parents of color, and tailoring services to be culturally responsive so resources and policies can be just a better fit for families. And as was highlighted in several of the presentations already, there obviously is a historical, urgent, and ongoing need to address racism in society in general. That said, child welfare still needs to increase their efforts to address noted disparities for resource parents of color. And this may include equitable access to services, communicating better with communities of color and building appropriate supports, improving existing programming, and generally taking steps to better understand the unique intersection of being a resource parent and a person of color. Further, social workers appear to be an invaluable resource, and using virtual platforms like Zoom should continue to be incorporated into standard operating procedures. And it seems that many resource families are able to access services when we're able to meet them where they're at. To date, we've done quite a bit with this data set. So we have a publication that you can see on the screen. We've also had the opportunity to present this at numerous conferences across the country. And there is also a research brief available, I believe, on Pritzker's website. And then continuing on to the next project, resource parents and the overlay of the COVID-19 and racial injustice pandemics. So the emergence of the COVID-19 pandemic created, as we all know, I think the word of the last few years has been unprecedented global health crisis. It impacted children and families in many ways, disproportionately affecting minoritized communities. Simultaneously, protests and anti-racist uprisings against anti-Black police violence, particularly spurred after the murder of George Floyd, took place worldwide, even leading to the CDC in the United States declaring racism as a major health crisis. And the co-occurrence of these two pandemics, I think it's been referred to in the medical literature as a syndemic, was unique and polarized discourse during this time. So using the same data set that we just discussed, we aim to shed light on the experiences of resource parents and how they navigated these two pandemics simultaneously, the COVID-19 pandemic and the racism pandemic in this country. So I'm going to organize this by theme. So qualitative analyses done with Dr. Kenyon Whitman, many of you who likely know him or worked with him. He's now faculty at UNLV. We worked together on qualitative coding for this data, so it's a mixed method study, and several main themes emerged, one of which was concern for children. 30% of resource parents reported moderate to severe impact on the children of their care when speaking specifically to matters related to social injustice, the media coverage, and the subsequent uprisings. And 33% of resource parents reported serious concern about the mental health of the children in their care specific to these events. So here's some direct quotes that came from resource parents. "My child is concerned what will happen to them if they are stopped by the police because they are Black. Their sense of stability was rattled. It is difficult for them to understand why people would treat each other in this manner as they are processing their own personal trauma. The events only added another layer of trauma to my foster children." Another theme that came up was generally stress, anxiety, and fear experienced by resource families. So over half reported moderate to severe impact from the social injustice events. A third reported serious concern about their own mental health as resource parents specific to the events. And about half of resource parents reported moderate to high levels of general exhaustion. Other quotes: "I am feeling a constant helplessness and some sadness and fear. I am a Black woman raising a Black son. I've always dealt with the anxiety of police brutality, but now I'm anxious about my son too. Now at least people outside of the Black community are getting exposed to the terror we're dealing with. I'm working through how to explain to a young child the nuanced nature of police being protectors and yet the evidence of their brutality, which makes them not always safe. Figuring out how to navigate that with a child is incredibly difficult. I think my son could detect my anxiety." The next thing we did is a series of ordinal and multinomial regressions. And what these analyses showed was generally that the impact of COVID-19 and social injustice were interwoven. When I speak about adverse impact, that's related to resource parents reporting difficulty with meeting their children's needs, meeting their needs with other responsibilities, general anxiety about the pandemic, lack of control. So you can see that an increase in adverse impact of COVID-19 was associated with caregivers having, actually, I guess the other thing I'll say, other questions we asked about racial and social injustice was how families were communicating about these events in their house. So you can see an increase in adverse impact of COVID-19 was associated with caregivers having fewer conversations with the children in their care about racial injustice. An increase in reported access to resources related to COVID-19 was associated with an increase in importance of having conversations about racial injustice. Helpfulness of tangible resources, the higher that was, the more conversations either being initiated by resource parents or the children in their care about racial injustice were happening. and an increase in adverse impact, coping challenges, interpersonal conflict at home, and financial worries were generally associated with caregiver exhaustion. So our hypothesis that COVID-19 and racial injustice impact would be associated was confirmed. Families struggling to cope with COVID-19 were also more impacted by the racial injustice events. While not discussing the events may have been a choice by some, others may have had difficulty broaching these topics due to not having other basic needs met, kind of using that hierarchy of needs framework, holding that in mind. When looking specifically at conversations about race and racism, 80% of resource parents endorse moderate to extreme importance of discussing race and racism. However, only a third of them report, or at least a third of them reported that they still did not discuss these topics with the children in their care. Two other themes related that emerged were race evasiveness and confronting race. Findings show that some resource parents turn to one another to create dialogues around the events, despite viewing the events through the lens of different generations, diverse racial ethnic identities and backgrounds, while others avoided having conversations. So the race evasiveness, it kind of comes up as color blindness here. Because there is no systemic racism, these are direct quotes from resource parents, I believe my actions and kindness towards all people are the best way for my kids to learn how to best treat each other with respect and kindness. We focus on the good things that police, all different races and backgrounds, contribute to our society. We make sure our kids respect police and authority figures. We teach them to love and respect all people. We will never teach our kids critical race theory or anything like it. And then the others who confronted race. These events were all hot button issues in our home and often spark heated debate. Our daughter arrived at age 14, so her perspective on certain issues is radically different from ours, but these events forced conversation after conversation at an already tense time. They have given us opportunities to talk to our children about these events and the things that led up to them. We use it as a way to help educate and focus on the underlying causes and what we can do to help. So as far as recommendations, I'll go through these quickly because I want to make sure Vanessa has time for hers as well. I think racial socialization can act as a protective factor. I think it's incredibly important for systems to essentially decenter whiteness and incorporate what we know about racial identity, intersectionality, and racial socialization, particularly for caregivers of transracially adopted youth. I think it's important for them to reflect on their own privilege and actively work to understand their children's experience from their perspective, incorporating what we know from existing racial socialization literature. And so that's the main takeaway there. I'm going to pass it over to Vanessa to go over the final two. And you're going to share your own screen, right, Vanessa?
Okay. Yes. Hi, everyone. Can you see my presentation? Yeah, okay. Awesome. Okay. So I'm going to do a quick introduction. My name is Vanessa Perez, and I'm the research coordinator at UCLA TIES. And so I'm going to be presenting two studies. And the first one is an examination of the impact of COVID-19 and racial injustice on college students, the history of foster care experience. So as we know, the COVID-19 pandemic impacted the lives of many people and magnified inequalities in society for marginalized communities. For foster youth, the pandemic was catastrophic as they found themselves struggling with housing, access to food, mental health challenges, and other basic needs. While the United States and the world were navigating COVID-19, George Floyd was also murdered. A video surfaced of the lynching of Ahmaud Arbery, and reports came out that Louisville police officers were involved in the killing of Breonna Taylor. These killings and the many others prior were a prominent reminder of the racism that exists in America. On April 8, 2021, the Center for Disease Control declared racism a major public health issue, and foster youth were faced with navigating the confluence of two pandemics, COVID-19 and racism. And for those attending college, this was particularly difficult. And so this project had two primary aims. to understand how did foster youth in Los Angeles County navigate college during COVID-19 and the racial uprisings. And 2, how did college campuses support college-going students with foster care experience during the COVID-19 pandemic and racial uprisings, particularly looking at institutions responses and resources that were offered to support them, and what resources and supports foster care youth, college students with foster care experience would like to see continue. And so there were 3 primary methods in which we sought to answer our questions. The first one was by collecting survey responses. We actually sent out a survey to college students late last year, and we got about 200 responses. And college students included those who were attending Cal State's, UCs, and community colleges. And in addition to the survey, we also did focus groups where we interviewed current students and the staff that support them. And third, we also did some document analysis, which included collecting emails and announcements from universities regarding the COVID-19 pandemic and the racial uprisings. And so here's just a brief. Okay, here we go. Here are just some demographic breakdowns of our population, or at least for the survey. As you can see, most of our participants identified as Latinx, Black, or African American, or multiracial. Furthermore, you can see that the breakdown of what type of institution that students attended. You can see that 39% attended Cal States and 39% attended community college, and 22% attended UC. And additionally, most of our participants identified as female and were between the ages of 18 and 52 years. And so I have some preliminary analysis to show you all. And so in regards to the adverse impact on health and safety, 70% of college students reported that the pandemic had moderate to significant impact on them as someone with foster care experience, and then 83% reported that the murders of Black individuals, anti-racist uprisings, and related protests had moderate to significant impact on them as someone with foster care experience. And so the top 3 concerns that were reported in the survey included finance, mental health challenges, and the well-being of close family members and friends. And all of these indicated endorsement of moderate to extreme concern. And so here are some of the anecdotes that we collected through our focus groups. And so the first one says, when I was put into foster care, the police were nothing but mean to me and my siblings. They did not show us any type of sympathy or kindness. So seeing that other people are being treated this way, especially the murders of George Floyd and Breonna Taylor, it's angering. It gets me angry. Why do they treat us this way or anybody this way? Then another student reported, I ended up quitting my job. I ended up because I just couldn't handle the reality of how things were changing. I ended up dropping out of school. It was really hard. It was a really hard experience. And not until a year afterwards was I really taking reality in. And then from there, everything got back, I guess, to as normal as it possibly could be. And so I think the way that the COVID-19 impacted me was more like on an emotional level, and like what I said, like re-traumatizing because it was so unexpected. And that's kind of how a lot of my childhood was. And so in terms of student satisfaction with the campus response to both the pandemic and the racial uprisings, 53% reported moderate or high levels of satisfaction with the school's response to the COVID-19 pandemic. And 40% reported moderate or higher levels of satisfaction with their school's response to the racial injustices that were occurring. And so for a brief, I have one anecdote on the side. And so the student said, did I feel it was sufficient? Not really. I feel like it could have been more information, I like more because I really like to break it down into pieces. So I can understand what is actually going on. But I wanted more. I didn't just want one email with an apology. It's still going on. Okay. And so And so this is relatively new data. So we're hoping to deliver it to multiple or disseminate it in multiple ways, not only through research. One of the things that our team has really been talking about is disseminating what it is that we do end up finding to people empowering colleges, so that way we can learn from their experiences. Again, this is just preliminary analysis, so that we're going to be finding more about what these individuals experienced during this time, but we're really hoping to present this data to individuals who can make change, hopefully at the institutional level. All right, and so then for the next, and so in terms of deliverables, currently we have a publication in progress, and we submitted a paper or presentation to present at the Association for the Student of Higher Education convention. Okay, and so then the next study is going to be regarding equity, access, and engagement in telehealth, mental health services for child welfare involved families. Okay. And so I'm going to be going for giving a bit of background information so you can understand the context of the study. So youth with foster care experience have disproportionately higher rates of mental health problems due to early life adversities that they experience, including abuse, neglect, trauma, home instability. Past research has demonstrated that up to 80% of children with foster care experience have significant mental health problems, which is 4 times the rate of youth in the general population. In addition, youth with foster care experience are twice as likely to report suicide ideation and 3 times more likely to attempt suicide than same-age peers without foster care experience. The research also suggests that young adults who age out of foster care continue to experience higher rates of mental health challenges than adults with foster care experience. For instance, a national report found that about 25% of foster care alumni have been diagnosed with post-traumatic stress disorder, which is 2 times higher than American veterans and 6 times higher than adults in the general population. So overall, we can see that that experiences in foster care represents a significant risk factor for the future development of psychopathology, which underscores the need for accessible clinical interventions. In 2021, the American Academy of Pediatrics reported that psychological and behavioral care is the greatest unmet need of children and teens in foster care. And prior research supports this, as research has suggested that youth are not accessing services consistent with their needs. For instance, one study found that half of youth who were investigated by the child welfare system were identified with significant mental health problems. However, only a quarter of them received any services a year after. Another study found that about 75% of children younger than 6 who had clinical needs and were part of the child welfare system did not receive mental health services for the first 12 months of initial contact. Furthermore, mental health service use dropped substantially, about 50 to 60% for foster care alumni, even though many still experience psychological symptoms, which places them at greater risk of experiencing homelessness, substance use, incarceration, and unemployment. Since research supports the effectiveness of psychotherapy for foster care youth and alumni, the underutilization of mental health services by this population is problematic and warrants further investigation. So, although we have established that access to treatment is an essential first step for alleviating the mental health burdens that youth involved in foster care experience, keeping youth engaged in ongoing therapy poses another challenge that must be addressed, particularly as national research has indicated that about 50% of youth who engage in services drop out from treatment prematurely. And reasons for mental health disengagement include lack of parental involvement, poor therapeutic alliance, transportation difficulties, stigma associated with receiving mental health services, And foster and adopted youth face similar and unique challenges as youth in the general population that deter them from engaging in ongoing services. So,
I don't want to, sorry for interrupting. I just know we're running low on time. So I just wanted to make sure you get to the findings of your study.
oh yeah, so sorry. Okay, let me just go forward. And so during the implementation of, or I guess during the onset of the COVID-19 pandemic, a lot of mental health agencies shifted to using mental health services, or using telehealth to deliver mental health services. And so that included UCLA TIES, which is a multidisciplinary agency that provides services to current and foster youth and their families. And so prior to our study, there wasn't any research exploring how that shift to telehealth services impacted service utilization and engagement in services. So by following 55 clients through 1 year of in-person services and 1 year of telehealth use, we found 3 major findings. The first one was that clients and their caregivers attended more telehealth sessions and spent more accumulated time in treatment than during in-person. And second, clients had briefer sessions during telehealth than during in-person. And third, engagement during telehealth was never lower than in-person services. And all of these results held true across diagnosis, treatment modalities, and yeah. And so in terms of implications, since research has underscored the difficulties for engaging youth with foster care experience in mental health services, telehealth might be a potential solution to promote continued service engagement among this population, especially among foster alumni who have higher rates of dropping out. Further, in light of the negative mental health consequences of the pandemic and the increased demand for mental health providers, telehealth could be used to meet the increased need for individuals across distance. In fact, a report by the Child Mind Institute found that 78% of caregivers who had received telehealth services for their children since the start of the pandemic were likely to continue telehealth services after the pandemic. These results, coupled with the findings of our study, suggest that telehealth may be a popular and effective post-pandemic treatment option. And telehealth might also facilitate the coordination of youth care to increase access and ongoing engagement in mental health services. And when young people in care change family or residential placements, they may also have to change mental health providers, creating another loss in relationship. So telehealth might offer a mechanism for continuing the continuity of mental health treatment and therapeutic relationships despite placement changes. So, okay. And here are some of the deliverables. We've also published these results in a paper, which you can find. And we've done a whole ton of presentations at the regional and the national level. And I believe we also have a brief available at the Pritzker Center website.
Thank you so much, Vanessa and Matt. You did so much work.